Okay, stop what you are doing. Seriously, hold up your hands right now and just take a really good long look at your fingernails. Welcome to today's explainer. We're going to decode the secret language of your body.
Because think about it. When was the last time you actually looked? I mean, not just to trim them or paint them, but really observed them. See, here's this fascinating detail most of us just completely ignore. Your nails, they actually act like an early warning dashboard for your entire body. They're literally one of the very first places your system tries to flash a warning light when something goes wrong under the hood. Yep, your nails are trying to warn you, and today we're translating those warnings. We're going to walk through 8 distinct nail signs. Now don't panic. Some of these are completely harmless, and I'll put your mind at ease. But as we keep going, we're going to uncover some pretty serious red flags. This all leads up to sign number 7, which is a massive, life-saving warning you absolutely cannot afford to miss. Oh, and real quick before we jump in, this explainer is just for your education, right? I'm not your doctor. So if you do spot any of these signs on your own hands, definitely go see a real healthcare professional. Okay, let's dive right in. All right, Section 1, common myths and textures. These are the everyday signs you've probably wondered about. Starting with one, I guarantee you've had at least once. So let's bust a myth we all grew up hearing. You know those tiny white spots? Grandma probably said you were low on calcium, or maybe your friends swore it was a zinc deficiency. Well, here's the truth. They're almost entirely wrong. Most of the time, those spots, which actually have a super fancy medical name, punctate leukonychia, are just from a tiny little bump to the nail that happened weeks ago. You bumped the nail matrix, and as the nail grows, the white spot just rides along until you clip it off. No big drama at all. But here's the catch. If white completely covers the nail, or if you're seeing thick horizontal white bands across multiple nails, that's a totally different story. That can actually point to liver or kidney issues, and you definitely want to get that checked out. Now, this builds right into our second sign, brittle, splitting, or peeling nails. Look, for a lot of us, our nails are just super thirsty. You're washing dishes without gloves, using harsh cleaners, or washing your hands constantly. You're basically just stripping the moisture right out. But if your previously strong nails suddenly turn into a peeling, fragile mess, you need to pay attention to these next symptoms. If those brittle nails come with feeling constantly exhausted, having unusually cold hands and feet, noticing more hair in your brush than usual, or even unexplained weight gain, your body is flashing a massive warning light. That specific combo, it usually means you need a blood test to check for low iron, so anemia, or maybe an underactive thyroid. All right, next up we have vertical ridges. Take a really close look at the surface of your nail right now. Do you see thin lines running straight from the cuticle up to the tip? Honestly, most of the time, these are completely harmless. Just think of them as wrinkles, but for your nails. It's totally normal, especially as we get into our 40s and beyond. But I want you to try a quick test. Run your fingernail across the ridged nail. If it feels relatively smooth, even though you can see the lines, you're totally fine. But if it catches and drags like an old school washboard, those grooves are way deeper than normal. Deep grooves, especially if they show up out of nowhere, could point to an inflammatory condition called lichen planus or certain nutritional deficiencies. Okay, we've covered the textures. Now let's shift gears slightly into section 2, when colors mean danger. The stakes start escalating here, and that body dashboard of yours starts flashing a bit brighter. First up here, yellow nails. Now we're going to start harmless and then cross over into medical territory. If you rock dark nail polish without a base coat, well, congratulations, you've just stained your nails. If you smoke, the nicotine and tar will literally stain your fingertips yellow. But if we rule those two out, we get to the medical causes. The most common culprit is a fungal infection. You'll spot this because the edge of the nail will get all thick and crumbly. It's totally treatable, but it's not going to just vanish on its own. And if it's not a fungus, persistent yellow nails can actually be an early indicator of psoriasis, thyroid problems, or even chronic lung disease. The basic rule of thumb here, if it doesn't grow out or clear up in a few weeks, definitely let a doctor take a look. Now, I need to be absolutely incredibly clear about this next color, blue or purple nails. Look, if you just walked inside from a freezing winter day and your nails are a bit blue, totally normal. Your body's just hoarding warm blood around your vital organs. But if you're sitting in a warm, cozy room and your nails still look bluish or purple, your blood is actively lacking oxygen. This is a critical, flashing dashboard warning that your heart or lungs are struggling. We're talking potential heart failure, severe asthma, COPD, or even a blood clot in the lungs. If this happens suddenly, and especially if you're also feeling short of breath, dizzy, or if your lips turn blue, guys, this is a true medical emergency. I am talking about a literal 911 situation. Do not wait. Let's move from color over to section 3, serious shape changes. We're looking beyond the nail plate now and examining the actual physical structure of the fingertip. This brings us to a condition known as nail clubbing, and it is honestly one of the most visually dramatic signs your body can throw at you. Normally, your nail just rests on your finger with a nice, gentle upward arch. But with clubbing, the very tip of the finger slowly swells and puffs up over time. And as it puffs up, the nail actually bends and curves downward, kind of wrapping around the swollen fingertip, almost like it's giving it a hug. And because this happens so slowly, like over many months, the person experiencing it almost never even notices it happening. So the absolute crucial point is why this happens. Believe it or not, doctors have actually known about nail clubbing since ancient times. Seeing this rounded, puffy shape, it's almost never an accident, and it's almost never just a harmless quirk. It is heavily linked to some pretty significant internal issues. We're talking chronic lung disease, including lung cancer, as well as congenital heart conditions, and inflammatory bowel diseases like Crohn's or ulcerative colitis. If your fingertips have taken on this puffy, downward curving shape, you absolutely must book an appointment with your doctor right away. All right, we've arrived at section 4, the deadliest nail sign. Please pay very close attention here, because this is the absolute most important warning in this entire explainer. I want you to look at all of your nails right now. What you're scanning for is a dark brown or black line. It runs perfectly straight up the nail, kind of like a vertical stripe, extending from the base, near the cuticle, all the way up to the tip. Now, a quick caveat. People with darker skin tones can sometimes naturally develop these stripes, and sometimes a simple, everyday bruise under the nail can mimic this exact look. But there is one specific cause for this line that makes dermatologists literally stop everything and pay immediate attention. That cause is subungual melanoma. It's a form of skin cancer that grows directly underneath the nail. And what makes this so incredibly dangerous isn't just the cancer itself, it's human nature. People see this dark stripe and they just ignore it, sometimes for months or even years. They assume they must have shut their finger in a drawer and just forgot about it. They assume it's just a stain or just a weird little quirk of their body. Listen to me. You need to see a dermatologist immediately if any of these criteria apply to you. If you have a dark stripe that is new and just appeared recently, if it's actively getting wider or darker over time, if the dark pigment is sort of bleeding over into the skin surrounding the nail, or if it's only happening on one single nail. This is all especially true if you're between the ages of 40 and 70. Seriously, do not wait. Do not just cross your fingers and hope it grows out. Early-stage melanoma is highly curable. Late-stage melanoma is not. You have to act fast. Okay, let's take a breath and lift the energy back up a bit as we move into section 5, the bonus sign. This one is really often overlooked. It's a subtle texture warning that most people completely miss. Look really closely at the surface of your nails again. Do you see tiny little dents? It literally looks like someone took a very fine sewing pin and just poked the top of the nail dozens of times. This is called nail pitting. And what's really fascinating here is the medical connection it makes. Pitting is heavily linked to psoriasis, which is an overactive immune system condition. A lot of people think psoriasis only causes those scaly red patches on the skin, right? But up to half of all psoriasis patients will actually see these exact tiny pits in their fingernails. And that brings us to the ultimate cheat sheet. Go ahead, pause this explainer right now and take a screenshot of the slide. This is your master body dashboard guide. We've covered the whole shebang. Everything from the totally harmless white spots of a bumped nail to the urgent 911 emergency of blue nails, all the way to the drop everything and call the dermatologist urgency of a dark streak. Your body is doing its absolute best to communicate with you. And now you finally have the dictionary to translate exactly what it's trying to say. Your nails have been working hard to get your attention. The absolute least you can do is take 30 seconds to check them out. Look, I'm not saying you definitely have something hiding under the hood, but you might. So look at your hands right now, think about the people you love, a parent, a sibling, a friend, and ask yourself, when was the last time they really looked at theirs? Which of these 8 signs surprised you the most today? And more importantly, who are you going to share this critical information with? Keep learning, keep looking, and we'll catch you in the next explainer.